Celine Marie Claudette Dion is a Canadian singer. She was one of the great stars and singers in the late 90s and the early part of this century, but then seemingly disappeared off the radar somewhat. Her beautiful looks had changed quite significantly, and recently she revealed her quite shocking diagnosis of stiff person syndrome, or SPS, something that is sadly incurable. But what exactly is SPS? What causes it? What treatment options are there? And how long is she expected to live now? Hi, welcome back to the channel. My name is Dr. Aziz. I'm a physician based in the UK, and in this video I'll be explaining in jargon-free language what exactly stiff person syndrome, or SPS, is, what causes it, what symptoms a person with this condition exhibits, possible treatment options, and how long someone with this condition is expected to live. The definition. So let's define SPS. SPS was first described in the medical literature by doctors Moersch and Woltman in 1956 as stiff man syndrome. The disorder is now known as stiff person syndrome to reflect that the disorder affects individuals of any age and both genders. But what exactly is it? SPS is a rare progressive neurological disorder, meaning a disease of the nerves. Symptoms may include stiff muscles in the trunk, the torso, arms and legs, and greater sensitivity to noise, touch and emotional distress, which can set off muscle spasms. Over time, people with SPS may develop abnormal, often hunched over postures. Some people may be too disabled to walk or move. Many fall frequently because they do not have the normal reflexes to catch themselves. This can lead to serious injuries. People with SPS may be afraid to leave the house because of street noises or the sound of a car horn. Something as simple as this can trigger spasms and falls. Who does SPS affect? SPS is an extremely rare disorder. The exact number affected is unknown, although one estimate places the incidence at approximately 1 in 1 million individuals in the general population. The distribution of SPS between men and women indicates a female predominance. In fact, some evidence has suggested twice as many females are affected. SPS usually becomes apparent sometime between 30 to 60 years of age, which is the case with Celine Dion. She's 54. However, SPS has also been reported to occur in children and older adults as well. It is frequently associated with other autoimmune diseases such as type 1 diabetes, thyroiditis, vitiligo, and pernicious anemia. Autoimmune disease means a disease when the body attacks itself, usually for unknown reasons. What causes SPS? Scientists do not yet understand what causes SPS, but research indicates that it is the result of an autoimmune response gone wrong in the brain and spinal cord. Hence, possibly SPS is also an autoimmune disease, which, as mentioned, means a disease where the body attacks itself. Diagnosis of SPS. A diagnosis of SPS is made based upon identification of characteristic symptoms, a detailed patient history, and a thorough clinical evaluation. Additional tests can be used to support a diagnosis and to rule out other conditions. SPS is often misdiagnosed as Parkinson's disease, multiple sclerosis, fibromyalgia, psychosomatic illness, meaning physical symptoms caused due to mental health issues, or anxiety and phobia. A definitive diagnosis can be made with a blood test that measures the level of glutamic acid decarboxylase, or GAD antibodies. In electromyography, EMG, a test that records electrical activity in skeletal voluntary muscles at rest and during muscle contractions, can also help support a diagnosis. An EMG can demonstrate continuous muscle motor unit firing in stiff muscles, which is a characteristic feature of SPS. Treatment of SPS. There is no cure currently for SPS, nor is there any medication that halts its progress, which can be variable from individual to individual. Treatment is essentially about symptom control. Several symptoms improve with oral diazepam, an anti-anxiety and muscle relaxant medication, or with drugs that alleviate muscle spasms such as baclofen or gabapentin. Several different immunotherapies have been used to treat individuals with SPS, including plasmapheresis, corticosteroids, rituximab, and oral immunosuppressive drugs. All of these are drugs that essentially suppress the immune system, thereby can put you at risk of other infections. Other therapies are being evaluated, including non-myoablative and myoablative stem cell therapies. Prognosis, i.e. how long can a patient live with SPS? Because SPS is such a rare disorder, most of the literature does not really give a prognosis, simply citing that it can be variable depending on the severity of the disease and symptoms. One reference suggests that the prognosis from symptom onset to death can range from 6 to 28 years. So if we assume Celine Dion only diagnosed symptoms this year, she can expect to go to her 80s with current treatment and research. Anyway, I hope you learned something useful and enjoyed this summary. Be sure to check out these other videos which we've covered on celebrities and their health or their autopsy reports. If you want to keep learning about psychology, medicine, or life hacks, hit the like, subscribe, and notifications button. Any suggestions or comments, feel free to post below. Until next time, stay safe.